Welcome to Life Happens, where Texans come to protect their legacy and prepare for the second half of life. Join your host, Attorney Kim Hegwood with Hegwood Law Group, and our weekly guest as we navigate the challenges that emerge as life happens. Now here's your host, Kim Hegwood.
Good morning and welcome to Life Happens with me, Kim Hegwood, and our very special guest today is Bonnie Sheeren with Houston Health Advocacy. Good morning.
Good morning, Kim.
So today we're going to talk about something that's very important to a lot of my clients, keeping their loved ones safe and sound in the hospital. And you're going to talk about the Care Partner Project.
Yes.
So, because this is really a lot more important these days than ever before. So definitely something we want to, get some good information out there for our listeners. And so let's start off with, what's the most important thing that we can give, our loved ones?
The best thing in the hospital is to be with them 24/7, if it's at all possible. Most hospitals will make arrangements for us to spend the night. They'll bring in a recliner, they'll have a couch, they'll have something. Now, that's hard to do if somebody's working and got other commitments. So maybe it's time to rally the troops, get them all together and have them, make a plan so that you can always have somebody there. But in that case, you need really, really good lines of communication, like a notebook where everybody writes down the notes, so that one person doesn't come in and go, oh, I forgot to tell you, that sort of thing. So basically it could be electronic if people are tech savvy, it could be, whatever, but, that clear line of communication and having one contact person, because the doctors don't want to talk to 10 different people. They want to talk to one person. And it's okay if everybody listens in on speakerphone, as long as it's okay with the doctors. But if you have 20 different, everybody's worried and 20 different friends and family call in, that just sets up a bad relationship with the hospital staff. Also, getting a good relationship with the nurses, seeing what you can do, telling you want to partner with them. I want to partner with you. I want quick recovery and a shorter hospital stay for my loved one. And try to take some of the burden off them. They're stretched, they're stressed, they're short-staffed. If you can go get drinks out of the refrigerator for your loved one, if you can go get a blanket, if you can go get some little ice chips or something, stuff that they don't have to do, and they can do all the important stuff. They can do, the exams, the vitals, that sort of thing. So, it's a lot to do, but it's really important in these days when we just don't have the staff in the hospitals to ensure perfect patient safety.
So speaking of patient safety, what kind of infections should we be watching for? And are we talking those in the hospital?
The Care Partner Project, and full disclosure, I've been a member of the Care Partner Project for many, many years now, because I believe in their mission of patient safety, of helping people recover quickly and, getting out of the hospital, lowering the medical bills, everything. So, where do I start? There's, MRSA, there's C. diff, there's urinary tract infections, there's ventilation pneumonia. I can go on and on and on. The most important thing to remember is this. You need to be able to, those antiseptic wipes, kind of like we did at the beginning of the pandemic, where everybody was washing their groceries and everything like that. It is, you're never wrong if you take those antiseptic wipes and wipe down all the surfaces that might come in contact with your loved one, or that you might touch and then you might touch them. Also, any of the tubes, the IVs, anything going in and out, anything goes in and out of your loved one. This is not the time for, unfortunately, the hospital gowns, not a lot of dignity, but I had a relative in the hospital, and she said at one point she was naked, but she didn't even care because, she figured that was just part of the deal. It's check lines going in and out, see if you see anything, redness, any pus, and, anything that looks strange, just keep checking all the time. And once again, just be sure that everything that the hospital staff touches, that say like they come in with gloves. Well, they've been touching other things. They might have been touching other things or other patients, right? So they should have a new pair of gloves. They shouldn't come in with gloves. They should get a new pair of gloves. And then they shouldn't take those gloves and, start touching everything else. You want them to touch your loved one. So another important thing is hand washing. Everybody comes in. Sometimes the staff is not too jazzed about that because, hand washing, or hands kind of dry out, and, it's kind of like winter time when our hands get very dry and chapped and things like that. But, just find a very diplomatic way to say, please, 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 this is very important to me. Please, wash your hands. Karen Curtis, who runs the Care Partner Project, suggests offering like a Twizzler, like a little wrapped Twizzler or treat, here, I'll trade you the Twizzler for hand washing. Visitors, if they come in, gosh, they should be washing their hands too. And, ask who's coming in the room. Some of these teaching hospitals, every resident will come in the room. And sometimes you just, like, who are you? Do you need to be here? In a nice way, that sort of thing. Because the more people in the room, the more things get touched, the more, possibility for infections and things like that. And I mean, the ultimate thing is sepsis. You do not want sepsis. Sepsis is a bad reaction to an infection, but it starts with an infection. And that will wind up somebody from the hospital room to the ICU. And that is something none of us want.
Yeah, no, it's not a good thing to have at all. And so besides infections, what other problems should someone be looking for?
Gosh, I know this is going to feel a little overwhelming, but bed sores. The person needs to be moved every so often. And if they can't move, they need to have cushions underneath them. There's special pads that they put to prevent the bed sores, but have the staff kind of move them. If your loved one can get up, we were not meant to lie down. We're not meant to be sedentary. If they can get up and go to the bathroom by themselves, first of all, that's a great thing. I mean, dignity wise, like we get to use the bathroom by ourselves. And second of all, making sure they don't fall. So if they say, I think I can get up and go to the bathroom, get a walker, get anything that they have that prevents falls. There's pads that they can put on the floor. There's all kinds of devices and equipment that they have. The hospitals don't want to see falls. That is a mark against them. So they will bend over backwards to help you with this. And once again, the person in the room would help the person. I would go with them into the bathroom, hopefully, if they were okay with that. You really, want to watch for falls and fractures and things like that. Like I said, you got to keep your eyes and ears open and just be real vigilant.
So what should we ask for?
So many things. If, you can ask for consults. If you think there's an infection going on, you can ask for an infectious disease consult. You can ask for physical therapy if you think, that would help your loved one get, moving again and push their mobility. If they're having trouble swallowing or anything like that, there's speech therapy, occupational, certain things, if they're going home, that they might need to do around the house. There's all these different services they have to offer. And just, talking to the team, talking to the doctors, talking to the nurses and saying, how can we get my loved one back on their feet again? And what can we do? I want to work with you. Tell me what I can do and tell me what services you
when you're thinking about, checking for infection, what other kind of problems, what other things we should ask for, what else should we be doing during this time?
Um, Also medication. You got to watch for medications. Oh, there's so many things. There is checklist after checklist on the Care Partner Project. So basically, you can go through all those checklists, and there's lots of downtime in a hospital room. You can definitely go to the Care Partner Project website and check all the checklists. Also, it's kind of like when you get on a plane and they tell you to look at the safety brochure, and nobody does. Okay, I do. I'm an Air Force kid. Um, I do. I look where the exits are. I look how to get off the plane, because in a crisis moment, you're not going to pull out the brochure and start looking, right? You're really going to need to know. So the hospital's they're going to deluge you with all kinds of, papers and paperwork and stuff like that. Go to the Patient Bill of Rights, kind of read through that. It's a lot of fine print, but go ahead and look through it. Look through any phone numbers, contacts, anything important in the paperwork. Infection control is a good number to know. It might be a certain phone number, it might be an extension, I don't know, but go and start immediately learning the ways of that hospital, because all hospitals are different. Some hospitals you can actually ask for sitters. Okay, say like the doctor says, we need you to talk to us in the conference room for an hour or two. Some hospitals have sitters, and you can request a sitter to come sit with your loved one and make sure, nothing goes wrong. You can tell the sitter what you expect from them and things like that. So, it's just getting acquainted with what's going on, finding out who the case manager is, talking to the case manager. Once again, they're very busy, very overworked, but once again, we're going to work together. Social worker, because you may need some things on discharge, like a hospital bed or something like that, and they know where all those things are. Plan for the discharge the minute you get there, because you do not want that last day to be scrambling around and everybody in a panic. Like the hospital goes, your loved one has to go home today. The insurance says they have to go home. Unfortunately, insurance dictates a lot of our hospital stays.
Too much.
Yeah, too much. Yes. So, if they say you got to go home today and your loved one needs a hospital bed, and it's a Friday afternoon and you are searching the city for a hospital bed that you can rent. And also a lot of the medical supply places would be in network with certain insurance plans. So you want to be looking at that in advance. Like, tell the caseworker, hi, when you meet them in the hospital, say, hi, what do you expect my loved one might need when they go home? Oh, they might need a wheelchair. Okay, so you start looking, rental, buy, that sort of thing. Oh, they might need a hospital bed. Okay, rental, buy, what you want to do, so that you can, you're not scrambling at the last minute, because that's when a lot of bad things happen. And a lot of families get very, very stressed at that point. So planning for the discharge from day one is always a good thing.
That's really good advice, because it's not normally what you think about, when you go into the hospital. You're thinking about, how do I get them well, and how do I get them taken care of? And I'm probably like most people, thinking about what's going to happen down the road is probably not my most immediate. So it's a good reminder for people. And I appreciate that, to be thinking about the things they should be thinking about that they don't normally. So tell us how a health advocate can help families.
Oh, I love, this is my favorite thing to do. Once again, it's a lot of times hospitalizations are crisis moments. So there's a lot of emotional impact that goes along with these hospitalizations. So the family's overwhelmed. And while I'm saying, okay, look at the paperwork and look at the care partner project checklist, sometimes emotionally they just can't handle it. So I like to come in and kind of add some order, make a plan, help them kind of sort things out, because it's almost like people feel like they should know everything about a hospital. Maybe it's all the TV shows they've watched or something. I don't know, but they think they kind of know how a hospital, culture systems work. And I kind of come in and sort everything out for them. I'll say, this is who this person is. This is who this person is. They may not know that there's a charge nurse versus the other nursing staff. It's kind of good to know, because they don't necessarily introduce themselves. They don't come in. A lot of times, the doctors will come in. They don't, I'll say, which doctor saw you? And they'll say, well, it was a hospitalist. Again, their medical records, and I find out it's the nephrologist or, the infectious disease doctor, or, and they don't necessarily come in and say, I'm Dr. So-and-so and I'm with infectious disease control, or I'm Dr. So-and-so and I'm with surgery. A lot of times they just come on in. And so, I like to come in, give them a plan, help them kind of organize things, kind of see what we can do to work with the family, tell them, set up the lines of communication, and just kind of ease everybody's anxiety and worries and fears, because there are a lot of worries and fears. I tell people it's like they've landed on a different planet, but it's the planet and the world I live in. So I am very comfortable. I have my hospital shoes that I run around in, and that I can stand for hours on end and be comfortable. I just know how hospitals work. So that's why an independent patient advocate, and I'm a board certified patient advocate, can really help you figure things out when it's just like a tsunami of information and emotions coming at the person.
So such good information. So if they want to find you to help them, how do they find you?
They can go to my website, Houston Health Advocacy, all one word, .com. They can call me at 281-377-8484. My email is on my website. It is info, INFO, at HoustonHealthAdvocacy.com. And they can reach me. They can get on my calendar. They can call me. They can book an appointment. I always like to hear what people have to say when they call me, because sometimes actually what the thing they're most concerned about is not the thing to be concerned about. So I like to talk it over with people. So I offer like a 50-minute free consultation to see exactly where I can help and how I can help.
Perfect. All right. Thanks so much for being on the show today. Such good information always. It's a pleasure. And I'm sure we'll see you again in the future. And so you take care and enjoy the rest of your day.
Thank you.
Thanks for tuning in to this week's episode of Life Happens with Kim Hegwood. Be sure to tune in every Thursday at 10 a.m. wherever you listen to your podcast as we navigate through the challenges that emerge as life happens. The content of this podcast does not establish an attorney-client relationship or constitute attorney-client privilege, legal, medical, financial, or any other professional advice.